The outbreak of the Delta and Omicron variants in the past year has meant that countries are still not able to map a clear route out of the pandemic. The world has been in and out of lockdowns with a constant tweaking of COVID-19 restrictions. Measures aimed at protecting vulnerable groups, such as the elderly, have taken a toll. We bring you to Indonesia, Singapore and Australia to see how seniors are coping with the challenges. Hidayat Usman is glad to finally receive the booster vaccine. The 67-year-old received the first 2 shots of the Sinovac vaccine early last year. This time, he's getting a dose from AstraZeneca.
Kalau kita sudah vaksin ke 1, ke 2, dan ketiga itu sangat mendukung kita. Vaksin sangat penting bagi kami untuk menjaga kesehatan. Jangan kita sampai terjadi. Kita juga menjaga diri, juga menjaga keluarga sama lingkungan saya.
The booster shots are administered to those who have completed their vaccinations for at least 6 months. The campaign for the booster shots is being administered first in areas where 60% of the population has received 2 doses of the COVID-19 vaccines. The elderly can visit hospitals and community health centers to get their jabs. For those who are unable to come here, help is on the way. These volunteers in Bogor, West Java province, are on an important mission. They have been deployed to Sukamantri village to help administer COVID-19 vaccines in the homes of elderly residents. Jafar is receiving his 2nd dose of the Sinovac vaccine. The 70-year-old who has problems walking had to travel some distance from his home to get his first jab a few months ago. Jafar is relieved that he can complete his vaccinations in the comfort of home.
Kalau vaksin gini, apalagi didatengin gini, senang. Kedua kalinya. Jadi senang sekali gitu didatengin gitu. Jadi Bapak nggak angkat-angkat jauh-jauh gitu kan, nggak kuat gitu.
ADRA is an international relief agency that works with health authorities in the national COVID-19 vaccination rollout. The agency has an elderly first program to educate and encourage elderly residents aged 60 and above to get vaccinated. Volunteers from the agency hope to inject some much needed confidence to help them ease the fears of COVID-19 vaccination. They use the local Sundanese language to better connect with the seniors.
Mengajaknya tuh harus betul-betul dengan hati-hati sekali. Kalau udah lansia begitu kan ininya sensitif sekali ya perasaannya. Kalau mengajaknya itu dengan mari ibu mangga kalau mau divaksin supaya nanti kesananya diberikan sehat, terus jangan sampai emak kena penyakit atau gimana gitu ya. Saya pakai bahasa Sunda gitu.
As vulnerable as they can be, elderly are very often also an obstinate group. The task is proving an uphill one from the start. A recent survey conducted by ADRA showed that more than 40% of elderly are hesitant to get vaccinated. Their reluctance stems from several factors.
Kendala-kendalanya termasuk internal dan eksternal. Internalnya itu ada rasa takut atas efek samping. Mereka juga punya komorbid. Kemudian juga mungkin rasa takut, memang khawatir, takut mati begitu ya, karena dapat vaksin atau kalau nanti disuntik vaksin mungkin dia takut itu. Tapi ada faktor eksternal juga sebenarnya, terutama yang berita-berita yang misleading ya, hoax seperti itu juga yang dirasakan oleh para lansia.
Yuyun is one of many elderly Indonesians who remains steadfast. The 72-year-old fears about the side effects of vaccines on her poor health.
Penyakitnya saya mah punya darah tinggi, lambung gitu. Sekarang makanan obat lambung tiap pagi gitu. Jadi nggak divaksin. Usianya udah tua ini, nggak apa-apa. Kaki udah sakit kalau jauh jalan teh ini sakit. Jadi nggak kemana-mana, di rumah aja. Cuman ke warung gitu. Jadi nggak usah divaksin aja, nggak apa-apa. Gitu.
Family members play an important role in persuading the elderly to protect themselves against the virus. However, in the matter of life and death, individuals should have the right to decide for themselves.
Dia kan punya hak ya. Sebagai manusia sama, kita punya hak mau tinggal kembali kepada diri masing-masing. Apa sih itu ya? Kegunaannya apa? Gitu. Mungkin kalau secara dipaksa dari pihak saudara, dari pihak pengurus mungkin efeknya nggak baik gitu kan. Tapi kita kalau menyampaikan sosialisasinya secara bertahap, secara baik-baik, mungkin insya Allah bakal mengerti juga gitu ya.
Indonesia is trying to prevent another surge in COVID-19 cases by accelerating its vaccination rollout. The government is wary about the threat of the new Omicron variant, which is more transmissible. More than 40% of Indonesia's elderly population have completed their vaccinations as of January this year. Vaccination of the elderly needs to speed up as more than half of the deaths in hospitals had come from this vulnerable group, especially those with underlying conditions.
Untuk meyakinkan, karena saya udah pengurus, udah yang paling pertama Pak untuk divaksin. Saya pribadi meyakinkan kepada warga, saya keadaan sehat walafiat setelah divaksin. Mumpung vaksin mendatangi warga. Kalau nanti udah subsidi pemerintah udah dicabut, itu kan, mungkin nanti kita yang akan mengejar vaksin, mencari vaksin.
COVID-19 has affected the level of healthcare in Indonesia as more resources are diverted to manage the pandemic in the country. At the peak of the pandemic in July last year, hospitals and community health centers became COVID-19 red zones as they got overwhelmed with coronavirus patients.
This community health center serves residents living in 4 nearby villages. The center has an elderly health program targeting residents aged 60 and above. It saw a dip in elderly patients during the height of the COVID-19 pandemic in Indonesia.
Elderly patients have refrained from visiting the center, fearing of getting infected. The number of elderly patients at the center dropped by about 50%.
Waktu itu kunjungan lansianya kan kita jangan terlalu banyak ya, jadi ya mungkin ininya aja ya sedikit lah, karena tempatnya juga emang kecil ya. Jadi kalau terlalu banyak kan jadi banyak kunjungan kan nanti, apalagi lagi pandemi kan, kerumunan ya. Jadi ya emang menurun tuh masa pandemi 2 tahun ini.
The COVID-19 pandemic in Indonesia has since improved. Elderly residents like Hidayat can go about his daily activities outside with less worry, especially after receiving 3 doses of the vaccine. But with COVID-19 expected to become a permanent health issue, concerns remain on those unvaccinated elderly, because no one is safe until everyone is safe. Next up, we'll explore the challenges faced by elderly dementia patients in Singapore during the pandemic.
Stuck in this lodge for almost 2 years, the residents of this dementia home have had to tolerate isolation over infection. The furthest that Ghazali Muhammad has physically been is a garden downstairs, because at 63, he's considered among those at highest risk of complications from COVID-19. But thanks to his new hobby, he can explore beyond his garden and even beyond our borders.
Their social life, their mental health were very, very much affected. A lot of them, in fact, verbalized to us that they want to go out. So we have to quickly come up with something to help to maintain and improve their cognitive health. And so we took a 3-pronged approach through technology, bringing the outside in, and to innovation.
The lodge overhauled its programs, providing access to computer devices and a revamped garden where seniors with green thumbs can plant and harvest produce. Areas like corridors have also been repurposed so that residents can reminisce simpler times. Before COVID, the home would bring residents out for activities, but now the outside is brought in. This wall mirror, for example, depicts life in a kampong, where residents can come over to engage with it, even interact with various items like this durian to stimulate their senses and trigger memories. As Singapore's population ages, dementia is becoming more common, typically affecting those aged 60 and above. Around 1 in 10 suffers from the condition, amounting to at least 80,000 people right now, and that's projected to increase to over 150,000 by year 2030.
I like to go out, I like to go to the community center, I like to go there and sing song.
But strict COVID curbs have meant that 83-year-old Peter Lim can't take part in his favourite activity. So the Lim family invested in a home karaoke system. While they're hoping to bring him out for more activities in time, it's an uphill task, showing that the pandemic affects the housebound as much as those living in homes.
Routines get upsetted, get thrown out of whack, and to re-implement these routines, it's not easy. Within these 2 years, Daddy also developed public incontinence. It used to be a 2-hour journey for preparation, but now it can be close to up to 4 hours, right? Because we need to make sure that we pack everything. We need to make sure that mobility is still able.
Dementia Singapore has tried to keep its daycare centres open as much as possible. But attendance has dipped by 40% as families keep loved ones at home and away from the risk of contracting COVID-19. And so the social service agency continues its work on the outside. This membership-based app links dementia patients and caregivers with wellness activities for free or at discounted rates. Patients also get a card with a personalized QR code. If they get lost, anyone can scan it to alert the caregiver. Around 1,800 users are on the app so far, with the goal to bump it up to 3,000 by May.
What we're trying to do with this membership is also allow an identification for people with dementia. So that will help. And even like going to a clinic for treatment, if a person with dementia sits in a clinic, doctor's clinic for too long, they can actually get very irritated and then very restless. So we're hoping that even some clinics, they can recognize the membership card and at least give some priority to the person with dementia. Let the person go first.
And it takes a village, so efforts to enhance dementia support are being extended to the wider community. I'm here in Yio Chu Kang, a town in Singapore that will be the first to incorporate dementia-friendly features across all its estates by 2025. One key feature is the colour zoning of blocks, where they're painted in vibrant and different colours so that persons with dementia can easily identify where they're at and to find their way home. More recreational spaces like community gardens will be built too, paving the way for activities just for seniors in a town where 44% of residents are 50 and older.
One initiative that we are trying to push on is having more go-to points in Yio Chu Kang. And these go-to points are really, can be anywhere. It can even be a provision shop here, where the owners or the auntie uncle there who are manning the shop would know what to do if they meet someone who has dementia. We are able to bring people with dementia back to their homes or to places where they can seek help.
The Agency for Integrated Care is leading efforts to build dementia-friendly communities. Now, on top of Yio Chu Kang, it's working with 13 other towns to reinvent their spaces.
What uncle or akong with dementia wants to do really is to continue to be able to go down to their favorite coffee shop, enjoy their coffee, take a bus, go to the nearby supermarket to do their grocery shopping. With some environmental upgrading and infrastructure, we are able to support persons living with dementia to feel safe, familiar, and continue to live in the neighborhood for as long as possible.
And the agency's not done. It's expanding its plans from neighbourhoods to public transport, like in the case of SMRT. It has trained staff deployed at 17 train stations and 5 bus interchanges in case people with dementia need help. It hopes to have such staff stationed along its entire public transport network in time. Coming up, we'll look at how the Omicron variant has disrupted Australia's plan to open up and live with the virus.
Australia is at a dramatic turning point in the pandemic. Authorities have abandoned their COVID zero strategy, which has helped protect the most vulnerable Australians, such as the elderly, for most of the pandemic. The Omicron outbreak is pushing infections to record highs, and now there's no turning back. Australians over the age of 60 account for just 10% of cases, but 90% of deaths. At-risk people here now have no choice but to grapple with what it means to live alongside COVID-19. After being kept apart for so long, every moment together is precious. Jim Grills couldn't hold his grandchildren for a total of nearly 9 months. The 72-year-old has endured 6 lockdowns and heavy restrictions in Melbourne to curb the spread of COVID-19. Millions of families like his have finally reunited during the holiday season.
Not seeing the family, not being able to go away anywhere. We did have some Zoom calls with family members and that was helpful to see how they were coping and what they were doing. But it's not the same as seeing family firsthand.
It took a heavy toll on families who stayed apart to keep each other safe.
We didn't know when it was going to be that we'd see them again, and it was pretty hard. They sort of were a bit teary when we left. We just wanted to cry because we just couldn't hug them.
The tears of sadness now replaced with scenes of joy. As politicians insist lockdowns are a thing of the past, people can almost taste what life was like before the pandemic. One of the things Jim is most excited about is getting back to teaching metalwork at his local men's shed. It's a place where older and often retired men gather to socialise, provide support and learn new skills.
A lot of people still, even though they're retired or they might be getting elderly, they still like to learn. They like to be stimulated, they like to share knowledge.
There are 1,000 men's sheds across the country and more internationally. They are modelled off the concept of the backyard shed that has long been a part of Australian culture. The initiative aims to provide an outlet for men to talk about their health and express their feelings, when generally, as compared to women, men are more reluctant to talk openly about their emotions. After several months of stay-at-home orders, organisers at the Akuna Park Men's Shed are encouraging their 160 members to get active again. Despite safety protocols in place, not everyone is confident to attend social gatherings now. Most members are aged between 50 and 90, which puts them in one of the highest risk categories for COVID-19.
People are still a little bit afraid. The fact that they haven't been coming to the shed says it all really, that even though we have a fully vaccination policy at the shed, they still don't feel 100%. I'm going to go down there where there's 20 or 30 men around.
Akuna Park Men's Shed President Morris Hall has been checking in on missing members.
Well, yes, g'day, how are you? I was just ringing up to say hello.
He's worried about older men who, like him, live alone during the pandemic.
Night times are always a challenge. Some nights you can be really good and you can phone people, your friends and your mates, but you'll have a night where you can't pick up the phone. You just feel a bit blue.
The optimism that many people had when they emerged from lockdown late last year is starting to waver. just after Prime Minister Scott Morrison declared it was time to reopen and live alongside the virus late last year, the highly infectious Omicron variant arrived. It spread rapidly and total infections have surpassed 1 million, more than half in this month alone. The latest wave is straining hospitals, despite Omicron appearing to be less deadly than previous variants. There are outbreaks at hundreds of aged care homes, which Dr. Sarah Russell is tracking. It has forced thousands of elderly people into a constant state of lockdown. But some facilities are isolating residents and banning visitors as a precaution, which she says can cause more harm to the elderly.
This is the last stage of a person's life in an aged care home, and I think we have to do everything to make that part of their life as good as possible, and part of that is seeing people who they love.
Swinburne University's Wellbeing Clinic for Older Adults provides remote counselling to elderly people in aged care.
That must be really tough.
Demand for help with issues such as depression, anxiety and loneliness is soaring. Mental health experts say long periods of fear, stress and isolation can trigger changes in the brain.
And what this is likely to provide is a greater incidence of cognitive impairment, of dementia, but also physical health problems going forward. We also know that social isolation in itself can be a predictor of early death.
Hi, Sarah. Yeah.
A visit from a volunteer like Natasha Karunaratna is one of the few opportunities that seniors have for meaningful interactions during these trying times.
Most of your visits end up in someone crying. A lot of people don't expect an outsider or a complete stranger who a volunteer is to come and spend so much time with you and just be so interested in your life during such a difficult time in their life.
She helps widows like Sarah Viney, who is isolating herself from others as much as possible. But it comes at a cost.
It affects me very deeply. It really does. And I think it's actually changed the way I am, because prior to COVID, you couldn't have kept me down.
In the face of yet another year of uncertainty and fear, older Australians are finding their own ways to keep hope alive. Whether that's through a conversation with a generous stranger, a celebration, or making plans for another family reunion someday soon.